A child's life is a gift, but data shows a growing number of children in the Tampa Bay area are not surviving their first year of life. In our ongoing series, Fracture, 10 Investigates, Emerald Morrow explains why and shows how one group in Hillsborough County is working relentlessly toward a solution.
These are our children.
The very health of neighborhoods and families is at risk.
These are difficult conversations to have, right? But they're so necessary if we want to make sure that our communities are moving forward and our children have a chance, not just to succeed, but to have a chance to live. Yeah, it's critical.
Hey, how are you?
I'm well, how are you doing?
Good.
Talking with Cheri Wright-Jones really helped peel back the layers to an incredibly important issue.
Black infants in Hillsborough County are 3 times more likely to die in their first year of birth than white infants.
That might seem unimaginable, but it is a reality for a lot of families in our area.
We don't have an answer.
We first introduced you to Ralph and Valerie Moore a few months ago. The couple tried for years to have a child together. Twice they conceived, once they delivered, but today none are alive.
I was so heartbroken because I couldn't figure out why was it that other women had their baby.
Thank you all for being here today.
It's a question the Black Infant and Maternal Mortality Task Force is trying to answer. A group of doctors, researchers, public health leaders, and families themselves, with Wright-Jones at the helm.
Why infant mortality matters is because it tells you and gives you an indication of what's happening in the community. The task force is critical and will be critical in moving forward programs and initiatives to reduce the Black infant mortality rate and disparity in Hillsborough County.
Because right now, Hillsborough County is struggling. Not only are more Black children dying before their first birthday, they're coming into the world with a host of health issues.
Black infants in Hillsborough County are 1.5 times more likely to be born prematurely. Also, Black infants are almost 2 times more likely to be born very low birth weight. With that, unfortunately, with our Black mothers, they are almost 2 to 3 times more likely to die from pregnancy-related complications.
But why?
One is the lack of prenatal care may also be coming in because those may not have transportation. They may not have someone to watch their children, working, those stressors of sometimes not feel like they're being heard by their providers.
Access to quality care, the health of the mom before giving birth, lower income, employment struggles. All these factors play a role. Valerie Moore says they're all factors that impacted her.
I really felt that if I had better medical help, that it would have been different.
Kiana Pitts is an advanced practice registered nurse and works with ReachUp Incorporated in Tampa, one of the groups behind the task force working to bring healthy children into the world.
We're located in the community, in the area that we serve, that are experiencing these disparities. And we have much work with home visitation programs, doula services. We also have clinic workers that work inside of clinics that we try to catch moms as early as possible to educate them about their risk factors.
But these programs, they cost money.
We absolutely could use additional resources in terms of funding.
But data shows state funding to address minority health has not increased much over time.
The state recognized back in 1994-95 that there were disparities in communities of color when it came to health care. They funded it initially with about $10 million, then it dwindled down to $3.1 million, and it stayed that way for 8 years. It stayed stagnant.
State Senator Darrell Roussan introduced new legislation to combat that.
This pandemic again taught us to pay attention to how disparities, health disparities. So it was important to bring it to the legislature so that we could actually do something about it.
The bill was successful, with Governor Ron DeSantis signing it into law last year.
Part of what the bill did was to require the gathering and analysis of data on access and quality of care.
It allocates more than $9 million to the Office of Minority Health. About 4.8 will go to programs that address health disparities, including infant mortality. Another 4.2 million will go to county health departments to create health equity plans. Each county will also get $55,000 for a minority health liaison, something Rusan says is long overdue.
We dropped the ball. We allowed the funding to dwindle. We allowed the FTEs to dwindle. And now we're reaping the disadvantages of dropping the ball.
But with this funding and the work of groups like the Infant Mortality Task Force, there's hope.
It is important that every baby, no matter their color, has the ability to thrive.
To learn how you can support the fight against infant mortality in our community, go to 10tampabay.com. You can also learn more about the task force and what it's like for families dealing with the loss of a child.